To this now, there are 2 recorded deaths from the 13 recorded cases of Mpox in South Africa since May. A number of the cases recorded were among immunocompromised people living with chronic illnesses such as HIV. What do we know about the spread and the containment of Mpox disease? Executive Director of the NICD, Prof Adrian Puren, joins us now. Prof, good afternoon. Thank you so much for your time. Really do appreciate it. 13 doesn't sound alarmingly high if you think about it as a percentage of concentration in population, but there are alerts about Mpox that should be taken note of. Why is that the case despite such a low penetration rate?
Yes, so in fact, the 13 cases are really just part of the multi-country outbreak that we've been experiencing since 2022. So thus far, in terms of confirmed cases, there are about 95,000 cases that have been diagnosed in several countries in different parts of the region. And you'll see that if you looked at the epidemiological curves, these have peaked in many other countries, but in South Africa, we only had 5 cases in 2022, but this year, thus far, we've had about 13 cases. So it's really important that we as public are aware of this particular outbreak and that we are able to stem the further transmission in the country, given that we have a large population that are HIV infected, and within that particular group are subgroups that are at greater risk than the general population. So I think it is important that we're aware of this and that we take the necessary steps to try and prevent further transmission, because again, the numbers can grow, and as you've seen, although we've only had 13 cases, these were the severe cases that we've seen. So it's likely that they are, because this disease has a spectrum of manifesting itself, that you can have just a simple rash and very little else to go with that, whereas if you are immunocompromised, you don't know your status, or you do know your status but are not on treatment, that there are some severe complications that can arise and lead to death.
What are some of the symptoms that potential carriers may need to take note of in order to report to a medical institution for testing?
Yeah, so the most characteristic that will really give you the clue that you may well have been exposed to Mpox is the characteristic rash. And this rash, as I said, can appear as a single vesicle or pimple, if you like, and then these can become more severe in the sense that they can be in the oral region, within the mouth itself, across the skin, hands and feet, but also specifically around the genitourinary area as well, where this rash can certainly manifest. The other symptoms that can go with this are, for example, fever, what we call lymph nodes or lymphadenopathy in the neck, just really feeling unwell. And so it's really important that even though you think you may have some other infection, that you in fact do present yourself for testing. And it's important, again, for our healthcare workers not to confuse and be aware that there is Mpox. So have that in front of your mind in terms of a so-called differential diagnosis, and also a request for other sexually transmitted infections, because it can be confused with other infections such as herpes, chickenpox, varicella, as well as syphilis and other bacterial infections.
That's a very important point, because my question is this: is Mpox sexually transmittable, or is it merely transmitted through close skin contact?
So it's within that context of sexual contact, for example, where there's skin-to-skin contact. So even though you may be wearing a condom, so I still encourage people to wear condoms during sexual activities. However, it's the close skin contact that's really important. It, of course, can be spread through face-to-face contact, for example, respiratory droplets. So those are the main routes within the so-called multi-country epidemic that we currently are experiencing.
So just for clarity, the wearing of a condom doesn't prevent Mpox, but it is the skin-to-skin contact that may be the contagion.
Yes, that's right. So that's the main route whereby this virus is transmitted. So I know that there's been discussion around whether we should call this an STI, a sexually transmitted infection, but it's really the sexual contact within skin-to-skin contact that's really very important.
Yeah, I mean, non-sexual skin-to-skin contact could also result in the contagion thereof. To this, what is being done around the containment of those who have been affected in order to prevent the widespread transmission spread of the disease?
Yeah, so we now in South Africa have an incident management team. That's a multi-sectoral team that looks at risk communication, as an example, the diagnostics, the various ways in which we can certainly control and manage this through the use of antivirals or vaccine. So there are lots of activities that are currently being instituted in order for us to try and stem this. So, for example, we know that there are certain public events that are coming across fairly soon with respect to the various affected communities. So again, risk communication is going to really be key. The Department of Health has certainly instituted measures, and we do know that there's an antiviral treatment that's now available for severe disease, such as tecovirimet or Mpox as it's called. And of course, there are some key discussions around, for example, accessing vaccines. And of course, very, very important is the risk communication to the different communities. Yes.
Yeah, we're going to have to leave it there. Thank you so much for your time and your insights this afternoon. Really do appreciate it. That is Professor Adrian Puren, Executive Director of the National Institute of Communicable Diseases.